A mouthwash a day keeps bad breath away. So today, our goal is to ensure that you get to keep your lover a little bit longer by introducing you to the over-the-counter and prescription mouthrinses that can help to refreshing your breath, protecting and strengthening your teeth. Let's get started.
Mouthrinse is defined as a liquid solution that you squish around your entire mouth to help promote oral hygiene. It is an adjunctive therapy to mechanical methods, available in prescription and over-counter, can be bacteriostatic or bactericidal, stable at room temperature, long retention in oral tissue, and safe to use.
These are the benefits of using the mouthrinse. It would help to prevent the tooth decay, strengthen the tooth enamel, refresh your breath, as well as control and reduce the gum disease.
Right now, we're gonna talk about the over-the-counter Listerine. So, as you can see in the picture about the active ingredient, that's why Listerine is the only over-the-counter mouthrinse that receives the ADA seal of acceptance to prevent and reduce the plaque and gingivitis. Alright, so Listerine, also known as essential oils, had different types. And then the first one, we had the Total Care Listerine, which contained the sodium fluoride 0.002%. It was proved to have up to 4 times greater fluoride, which help prevent the cavity, kill bad breath, germ, and clean the whole mouth effectively. The second type of Listerine we also know as the zero alcohol, which is the example of Listerine zero alcohol mouthwash coming in the picture. So this product had alcohol free and it has a less intense minty flavor. It's kills millions of bad breath germs for healthier mouth and is the number one dental recommend brand among all mouthwash brands. The first one is the calming antiseptic. And in this example, we have Listerine antiseptic mouth calming, which have destroyed 5 times more plaque above the gum line than floss, 21% greater gingivitis reduction than merely brushing and flossing alone. It also has reduced 52% more plaque than brushing and flossing alone. Alright, so now we're looking for the Listerine Sensitivity Zero Alcohol Mouthwash Fresh Mint. This product has crystal block technology with physically blocking tooth sensitivity. It provides 24-hour relief from painful tooth sensitivity, and it also contains the zero alcohol formula with a fresh mint flavor and have relief in 2 weeks with continued use for patients. For the next product is the Listerine Smart Ring Kiss Fluoride Mouthwash with Bubble Plus flavor. This product has the alcohol-free formula as well, which is kid-friendly, help prevent cavity and give bad breath. It's used for children 6 years and older as it contains the sodium fluoride 0.002%. And with this formula, it helps strengthen the teeth and prevent cavity effectively. And for the last product, which is the Listerine Green Tea Marathé Mouthwash, for this product, this were discontinued as of 2022. The reason for discontinuation were very, for example, based on patient needs and preference. However, in the website of Listerine, if the patient prefer the natural Listerine, for example, Listerine natural healthy gum, they can consider the Listerine cool mints. Alright, so for the FYI, the marine that contain the alcohol, which can cause burning sensation and also maybe contraindication for current and recovering alcoholic patient. So, as a dental hygienist, we can recommend them using the alcohol-free formula marine, for example, the Listerine Cumin Zero Alcohol or sensitivity Listerine with the alcohol-free marine is gonna help prevent the burning sensation and is also effectively for patient with current and recovery alcoholic.
Oral Care Tips, brought to you by Listerine, recommended by the Saudi Dental Society. How to best use Listerine. First, pour 20 milliliters of Listerine into a cup. Swish for 30 seconds. Feel that tingle? It's the boldness. Spit. Everyday routine. Brush 2 times a day for 2 minutes. Floss 1 time a day. And rinse with Listerine 2 times a day after brushing.
The next product is Colgate Whitening Mouthrinse. So it contains 2% concentration of hydrogen peroxide, which is the active ingredient. So this active ingredient gently removes the extrinsic stains on the enamel as well as intrinsic stain inside the teeth when used as directed. It is enamel safe. So this product claims to be gently enough to whiten teeth without damaging the tooth surface. It contains zero alcohol, so won't burn or leave a bad taste in the mouth. It is effective in freshening the breath, come in a variety of flavor, including the cool mint that tastes great and keep your mouth feeling clean. It is diluted with water, can take a little bit longer to remove surface stain compared to whitening toothpaste. According to Scientific World Journal, hydrogen peroxide mouthwashes increase the teeth whiteness over time, so it have long-term effect, but found no significant color changes in the first 56 days.
Our next over-the-counter mouthrinse could be ACT fluoride mouthrinse with an active ingredient of 0.05% sodium fluoride, which acts as an anti-cavity to help to prevent tooth decay, strengthening the enamel, and is also alcohol-free, come in many flavors. It is safe for adult and children over 6 years of age to use it once a day after brushing their teeth with toothpaste. It is also important to supervise the children at necessaries until they are capable of using this product without supervision. So the next product is for patient is currently dealing with xerostomia or dry mouth conditions. Biotin products, Biotin marins is a product that help to treat dry mouth and throat. It acts as an artificial saliva to help to moisten and clean the mouth. This product is alcohol and sugar free. The important part is it helps to relieve the mouth sores that caused by radiation treatments or dental wear, as well as for patients who have trouble with chewing, speaking, and swallowing. It is safe to use for adult and children over 12 years of age. This product can be used up to 5 times a day and lasts up to 4 hours. It's also important to recommend patients to avoid eating or drinking for at least 15 to 30 minutes after using these products.
In this slide, I'm going to talk about Grass Pro Health Mouth Rinse. Its active ingredients is quaternary ammonium compounds, contains 0.07% cetylpyridinium chloride, abbreviated as CPC. It is bactericidal, which means it can kill germs that cause plaque, bacteria, and bad breath. It contains zero alcohol, so ideal for many people. For each use, 20 milliliter of Crest Pro Health rinse is used for about 30 seconds, used twice a day. Less effective than chlorhexidine essential. It's beneficial in reducing plaque and gingivitis, freshening breath, and reducing halitosis. However, it can cause brow astringents.
So next I will use the repression chlorhexidine. The chlorhexidine mouthwash is used to lower bacteria in the mouth and can reduce the plaque and gingivitis. Use adjacent to with a toothbrush and use between a dental visit as a part of professional program for the treatment of gingivitis as characterized by redness and swelling of gingival, include gingival bleeding, upon rubbing. Chlorhexidine chlorinated is represented by the dentist. They have two kinds, Rivadex and Colgate Paragard. They all have the regular and non-alcohol. There are two products of chlorhexidine. The first one is Peridex. The second is Colgate Paragard. They are both contain a 0.12 chlorhexidine and antimicrobial activity of proceptum. There is clinical advice safe and effective for treat gingivitis, and they are both not using for a person who are known to be hypersensitive to the chlorhexidine chloride, and for the Colgate Paragard it have a fresh mint taste and a face. So contraindication for chlorhexidine is not be used for by person who know and have a sensitivity to chlorhexidine, and not be used for anyone younger than 18 years old, and make sure to not swallow the mouthwash. And disadvantage is chlorhexidine can stain the teeth, mucosa, gingiva, and also the tongue, and also notice temporary alterations of perception of the taste. So education administration in 15 ml doses, rinse for 60 seconds for twice a day. For gingivitis reduction, patients should be introduced to brush and floss their teeth and rinse all the toothpaste from the mouth thoroughly. Chlorhexidine occasion negatively interact with ania includes sodium fluorosulfate and sodium monofluorophosphate. To minimize the risk of the interactions, a waiting period at least 30 minutes should be allowed. After the dentifrice, you period to bring with the chlorhexidine. Only use the chlorhexidine for up to 2 weeks unless otherwise requested by your dentist.
Here are some of the key points of our presentations. Mouthrinse is only an adjunctive treatment for oral health and do not replace regular brushings and flossing. Use mouthrinse for 60 seconds 1 to 2 times a day and do not swallow the rinse. At this point, do you have any question for us? If not, then thank you for tuning in with us. You have a good day.